It's a sad day for 7 children in Manawan. It's sad because this is still there. Systemic racism still exists in the healthcare system in Quebec.
It's been 3 years since Joyce Echaquan, a 37-year-old Atikamekw mother of 7, filmed and live-streamed hospital staff in Joliette, Quebec, about 50 kilometers northeast of Montreal, making derogatory and racist comments towards her as she died. Indigenous people working in healthcare, like Dr. Stanley Vollant, the first Indigenous surgeon in Quebec, say Joyce's case represents what many Indigenous people have gone through while accessing health institutions, and not much has changed since her death.
There have been small steps, but not enough, and should be done all across the province, all across the country. The same thing happened in Vancouver, Edmonton, Calgary, Winnipeg, as well as in Quebec. So I think that we should promote and say that cultural safety is a thing that we have to implement in our healthcare system.
La sécurité culturelle, c'est de me sentir.
Cultural safety means feeling safe when I need help, both in the healthcare system and in other systems. To feel legitimate, to have the right that someone takes care of me when I need help, especially when I am completely vulnerable.
When people from my community, Pessamit, are going to Bécomo Hospital, they are afraid to go there. And often they won't go there. They're going to wait until they're going to be very sick. Cancer, very advanced. Diabetes, very advanced with complications. I thought it was just miscommunication. When I saw Joyce Echaquan die in front of my eyes, I changed my mind. I told myself I'm a traitor to my own people because I didn't believe them. Because I was educated, I was trained in the non-Indigenous system.
Quebec introduced Bill 32 in June, an act requiring health and social service institutions to adopt a more safe, welcoming, and inclusive approach when interacting with Indigenous people, including mandatory training on Indigenous cultural and historical realities. The Quebec Ministry of Health and Social Services says it's continuing efforts on cultural safety, appointing liaison officers, and around 93% of employees completed the mandatory training. On Bill 32, they say consultations took place.
Oui, il y a de la consultation.
Yes, there is consultation, but there is nothing co-created in this law. On security, they cannot speak for me or other Indigenous people.
Il y a beaucoup de gens qui ont pris conscience.
There are many people who have become aware and who want to participate in this transformation, but there also has to be a heartfelt recognition that there is a problem. 3 years later, we still have a long way to go. In Montreal, Alyssia Rubertucci, City News.